Cystic fibrosis causes and symptoms. Cystic fibrosis is a hereditary disease that affects the lungs and digestive system. The body produces thick and sticky mucus that can clog the lungs and obstruct the pancreas. Cystic fibrosis can be life-threatening, and people with the condition tend to have a shorter than normal lifespan. 60 years ago, many children with cystic fibrosis died before reaching elementary school age. However, advances in treatment mean that people with cystic fibrosis often live into their 30s, 40s and beyond. There is currently no cure for cystic fibrosis. It affects some 30,000 people in the United States, with around 1,000 new cases diagnosed each year. Of these new diagnoses, 75% are made in children under the age of 2 years. What is cystic fibrosis? Cystic fibrosis is a genetic disease that mainly affects the lungs and digestive system, but it can result in fatal complications such as liver disease and diabetes. The defective gene responsible for cystic fibrosis leads to the creation of thicker, stickier mucus than is usual. This mucus is difficult to cough out of the lungs. This can make breathing difficult and lead to severe lung infections. The mucus also interferes with pancreatic function by preventing enzymes from properly breaking down food. Digestive problems result, potentially leading to malnutrition. This thickening of mucus can also cause male infertility by blocking the vas deferens, or the tube that carries the sperm from the testes to the urethra. Cystic fibrosis is serious, with potentially life-threatening consequences. The most common cause of death in people with cystic fibrosis is respiratory failure. Symptoms. The most common symptoms of cystic fibrosis are salty tasting skin, persistent coughing, shortness of breath, wheezing, poor weight gain in spite of excessive appetite, greasy, bulky stools, nasal polyps, or small fleshy growths found in the nose. Cystic fibrosis obstruction of the lungs increases the risk of lung infections such as bronchitis and pneumonia, as it creates optimal conditions for the growth of pathogens. Obstruction in the pancreas can lead to malnutrition and poor growth. It has also been associated with an increased risk of diabetes and osteoporosis. Causes. Cystic fibrosis is an inherited condition. For someone to have cystic fibrosis, they need to inherit the defective gene from both of their parents. The defective gene contains codes for producing a protein that controls the flow of salt and water outside of the organs, including the lungs and the pancreas. In cystic fibrosis, the balance of salt is disturbed, leading to too little salt and water outside of the cells and the production of thicker than normal mucus. People with only one copy of the defective gene are called carriers. They do not have the condition or its symptoms. To have the disease, both parents must be carriers. If two carriers have a child, there is a 25% or 1 in 4 chance the child will have cystic fibrosis. 50% or 1 in 2 chance the child will be a carrier but will not have cystic fibrosis. 25% or 1 in 4 chance the child will not be a carrier and will not have cystic fibrosis. Over 10 million Americans carry the cystic fibrosis gene and are unaware. Diagnosis. All newborns in the United States are screened for cystic fibrosis by testing a small blood sample or samples. This can indicate that a baby might have a health condition and require further investigation. Cystic fibrosis is usually diagnosed through a sweat test. Sweat is collected and the amount of chloride, a component of salt in the sweat, is measured. A high level of chloride is an indication of cystic fibrosis. Genetic tests can also be carried out by analyzing check cells or a blood sample. These tests are mainly used to find out if a person carries the cystic fibrosis gene, but they can also be used to confirm a cystic fibrosis diagnosis following an unclear sweat test result. There are over 1,700 known mutations of the cystic fibrosis gene. As a result, most genetic tests for the condition only screen for the most common mutations. 75% of people with cystic fibrosis are diagnosed by the age of 2 years. The median predicted age of survival for people with cystic fibrosis is currently in the early 40s. Life expectancy is strongly affected by the severity of the disease, age of diagnosis, and the type of cystic fibrosis gene mutation. With routine therapies and healthful lifestyles, most people with cystic fibrosis can lead active lives.